Hello, Dementia Caregivers. Happy Saturday. And tonight will be a good talk in empowering dementia caregivers. And we have a special guest, making sure that we are live. All right. So, our guest for tonight will give us some awesome information about what a social worker can help our clients at home and the community for dementia caregivers. What are the resources out there that this lady can educate us? So let's welcome Christine Gorman Hardway. Hi, Christine.
Hi. Yes, Christine Hardway's fine.
Okay,
Nice,
awesome.
nice to be here.
Thank you so much for sharing your time with us and for teaming up with me to educate dementia caregivers caring their loved ones at home. And I am very excited because you will be providing our dementia caregivers and our audience of what is, the importance of a clinical social worker. And Christine is also a psychotherapist. So she does counseling, and that's a great thing about her. She has a website that you can check for her counseling services, which we will provide at the end of our presentation. And for any question, as you know, Christine share us all the information. Please drop your comments below, and we will check them and answer them for you. So now, Christine, introduce yourself and tell us what you do. Christine and I work together in the field. We do home health. So I do the physical therapy evaluation and the visits. And we bring in Christine to check the client and the family and educating them with all these resources, which you will learn tonight. And I am a big supporter of social workers because they truly provide a lot of emotional, psychological, and all this support that she will be talking about with us tonight. So, Christine, where do we start? There's so much to talk about.
I know. So thanks for having me on. I'm Christine Hardway. I graduated from Michigan State in 1995 with a master's degree in clinical social work, and it's a great degree. Work in a lot of different settings. I work in a lot of different home health settings right now, and I do counseling, and I also provide information on resources, much needed information on resources. So I've been in the field a long time, and yes, the reason we see each other in the field, which is nice seeing each other at patients' homes, and they would definitely benefit from various disciplines in the home. And that's a really nice thing that we do. We go to them because for a lot of older adults, it is harder for them to get out as they get older. So we go to them and visit them in their space. But yes, so I've been doing it a long time. I do some counseling with them. I do review resources in the community. A lot of people over 60 aren't aware of all the resources available to them in the community. And our goal, Lisa, as you know, is always to make sure people are really safe at home. The last thing we want is somebody to be on the floor and for hours and having got to the bathroom on themselves, and that'd be terrible. So we educate them about the importance of safety and talk about 211, the community, which is available 24/7 for any information or resources people need. Also, a Lifeline or a device similar to Lifeline that they can wear around their neck. Some people prefer nowadays to wear it around their wrist. And they can just press a button. God forbid they're by themselves and they fall stuck in the bathroom, taking a shower or something like that, and they need somebody to help come get them and pick them up and make sure that they're okay. So that's something I really educate people about. And then there's also Meals on Wheels or various meal delivery services. A lot of people find as they get older, it's just a lot. Cooking, cleaning up, it can really cause a lot of fatigue, and they're tired as it is. So they deserve that. They've worked hard all their lives. So sometimes they just like to have a prepared meal. And Meals on Wheels is a free service in the community. And then there's also other services as well, like a local service is 727 Prep, where they'll deliver fresh foods, and they're just a great local service as well. So those are some things I encourage. Just want to make life less stressful for them, make life easier for them. There's a caregiver program through the community for those who are financially eligible. There is a screening, and there can be a bit of a waiting list, but it is there. It is there for those who need it. There's applying for Medicaid as well. And there's a lot of great private caregiver agencies out there, and they provide some private caregiving for people, sometimes 2 to 3 hours at a time, to help them with whatever they need in the home. So that can be just a great resource as well. So just so many.
Yes, yes. Now, Christine mentioned about the lifeline. They are lifesavers. Having them, especially when your loved one live alone in their home, it's good to have that where, they wear it, around the neck or the wrist. So if they're not close to the phone, having the lifeline, they can press and have EMS come and check them. And also for the private caregiving services, these are the things that Christine assess, when she goes to the patient's home and assess your loved one. Then especially if they live alone in the early stage of dementia, they will really benefit for the private caregiving services, the meal deliveries and transportation, because that will really be your backup, and it will free you up from checking mom or dad every time and getting worried that they are alone. So the private caregiving services are also a good resource to consider. Now, for the transportation, Christine, they can sign up with DART or the Care Ride if they qualify, correct?
Um, Good question, Risa. Actually, Dart and Care Ride are similar. So Dart is the service and Care Ride is the carrier. So it's part of Dart. So there's Care Ride, and there's also neighborly services. And what the great thing is that everybody over 60 in Pinellas County is eligible. So you don't have to meet any financial requirements. You just have to complete the forms. There's like an application process, and they've made it even easier lately. They've updated their process, and it's even easier. So yeah, many people say really good things about Care Ride and neighborly services. Neighborly services will provide door-to-door transportation for up to 10 miles for free to the doctor. Care Ride will go a little bit further, and I believe they will take you to do some errands as well if you need to go shopping. And they're both free right now. So that's a really great thing. And I liked when you said that, there is an assessment involved, right? Because what we all do with home health is we'll go in and provide an initial assessment and evaluation and see what the patient needs. And then I also make suggestions and recommendations based on, if there's a caregiver in the home or they're financially eligible for certain programs, lots of different determining factors, so I like
That's
that.
great. Yes, yes. And also for the transportation, like the DART and the Care Ride, there's a window, when I call in also for the client and check. It takes about 30 to 60 days for the application. And most of the time, they need the ride to get to medical appointments, to see their
I
doctor.
know.
Yes, so just for dementia caregivers to know that there are private services that can provide the transportation as well. And for the private caregiving services, this is a private pay. It's a cash pay. So the caregiver from the company can also provide transportation for your loved one to take them to doctor's appointments and help them with groceries. So that's a good thing. Now, what about adult daycare center? Do you recommend that also if the caregiver or the family they're working and it's not safe for the loved one to stay home alone?
That's a great alternative as well. And I do have some patients that utilize adult daycare programs as well. And they're around $11 an hour, and it does include lunch. And they do provide some transportation too, I believe. So that's just a really nice alternative. People can get out, socialize, have lunch, can engage in activities. Many, like a lot of people, many of these older adults have really been isolated because of COVID and haven't been able to go. But a lot of these day centers are opening back up. And it's a really nice opportunity to get out of the house and be with other people. Because a lot of seniors, as we know, suffer from a lot of loneliness, isolation, and depression. So it's important that they get their social and emotional, mental health needs
Right,
met.
right. Yeah, the socialization and being out in a group like an adult care daycare center where you can leave your loved one on your working hours. Let's say, 9 to 5, or if you prefer a half a day, 3 days, you can arrange that with the daycare center. And it's good to know that the average rate is $11, including the lunch.
I know.
They also do activities, right, Christine?
Yes,
Um,
lots of
socialization,
activities,
crafts.
bingo, crafts, things to do. So it's someplace to go. It's someplace to go and socialize with others. It's just so important as we get older. Many people, I go to see are by themselves, because they've lost their significant other and they're by themselves. Maybe their kids are far away, or the kids are involved. Their grown adult children have their own personal obligations. So it's so important to have a lot of different ways of entertaining themselves and getting their needs met for caregiving. So yeah, I'd like to say there's about 3 adult day centers right now in the Pinellas County area. There's also there's some assisted living facilities that will provide respite for people. So I've had times where a caregiver of a patient has to have their own medical issue addressed, and they need the patient to go someplace for a week. So they'll go to like an assisted living facility for what we call respite for a week, and just stay there for a week to 10 days. And it gives the caregiver a chance to take care of themselves. So that's a nice perk that some of the ALFs offer as well. It's just important for people to know that information.
Yes, yes. The respite care, like assisted living facility, can be like, and we will talk about that for the home placement. For the respite care, this is a temporary stay in an assisted living
Okay.
facility. So it can be, you can arrange it with the facility that your loved one will stay for a week, a month, 3 months. So
Yeah.
for you, dementia caregivers have this information. And I actually had a patient, Christine, recently, and she is caring for her loved one with dementia. So he cannot be left alone. It's in the mild stage, but I'm educating about considering surgery. So she's the primary caregiver for her spouse with dementia. So she's very overwhelmed and worried about if I will get, surgery, stay in the hospital, I'm recovering, no one will take care of, her loved one. And that's
Mm-hmm.
one thing I shared is to consider respite care, private caregiving services. So, they can attend to the loved one while she needs to take care of herself, medically, and have that time to recover. So that's awesome. That's awesome. Now, for the advanced directives, when our loved one with the Alzheimer's and dementia, we know that this disease is progressive. What will you advise to our dementia caregivers about, getting all the legal documentations taken care of, like the living will, and the financial matters and the
Mhm.
power of attorney?
So yes, so that's advanced directives are really important. And when we talk about advanced directives, what we're really talking about is a medical direction to be given in advance of a situation. So the papers really speak for you when you're not able to speak for yourself. And there's a do not resuscitate. That portion comes from the doctor, which means if you're on the floor and you can't breathe, you don't have emergency medical personnel resuscitate you. And then there's the living will with the artificial and hydration measures to be withdrawn in the event that they're prolonging your life with those machines. So, and then there's the healthcare surrogate, and then an organ donation directive as well. So those are really important to complete sooner rather than later, because what we don't want,
Right.
as you said, is sometimes there's a cognitive decline and it's a progressive disease, which means that they just, if we wait too long, the patient isn't in a position where they can really understand what they're signing and what kind of direction that they're
Right.
giving.
Right.
So yeah, so we want to provide that education sooner rather than later. And then they can sign the documents, and then they just have to have somebody witness it and put it in a safe place and then give a copy to their doctor.
Right. So for the advanced directives, it's advisable to do it when your loved one can be part of the decision making. As far as,
Exactly.
yes. So get that situated early on in the dementia stage. We
Mhm.
advise that you take care of that and have a designated power of attorney or a medical surrogate.
Healthcare
Um,
surrogate, right?
Yes, yes. To make, eventually the memory will be worsening and decision making will be impaired. So it's best that one of your family that can make the decisions for your loved one.
Mhm.
Now, for the home placement, Christine, when we go to the homes and then check the client and usually they live alone, right? And we will make
Mhm.
recommendations that they are not safe anymore with the Alzheimer's and dementia. There has to be a high risk of falling because their safety awareness is impaired. Uh, you know, as a dementia caregivers, you worry about how will they be doing as far as when they're cooking, using the stoves,
Right.
microwave, are they safe? So those
Mhm.
are the things that Christine make recommendations of the home placement. This is the hardest part for the loved one with the dementia and also for the family caring for the loved one. Isn't it, Christine? It's like, the loved one will be losing the independence and then they have to let go of their own space, their own home.
Yeah.
So this
And a
is
lot of
something.
people, yeah, people do benefit from some counseling because these are some really tough discussions to
Yes.
have, and sometimes it's just important to take a look at the reality of the situation. And sometimes, it's hard to come to some real conclusions here and accept some losses, and take a look at that. So it's important to have the discussion and discuss, what we're comfortable with, and maybe set some boundaries and um, do some problem solving around ways of getting needs met. Yeah, because safety is the most important thing. Yeah, we can't compromise
Right, right.
our safety.
That's right. So for our VA clients, we know that they have resources out there as well. What can you educate dementia caregivers when they have loved one with VA benefits?
Yes, well, the VA, a lot of people have a doctor at the VA when they're a veteran. They get hooked up with the VA, and they do have social workers there as well. And we discuss different factors that make them eligible for what they call the aid and attendance program at the VA. And they do have a housekeeping companion program as well. So those are just important resources to know about. And there are some forms to fill out. And then sometimes too, they can be connected with a team that will advocate for them. So that's just good to just explain the process to them and get them to connected with that. And then we can call up the VA, and there's an
Right.
eligibility department. Yeah.
Yeah. Well, the first step will be discussing it with your loved one's VA doctor,
Yeah.
and there's an application process. They can let you know if your loved one qualify for the caregiving services through VA. Where I
Yes.
have clients at home receiving private caregiving from the VA. It depends on the medical condition of your loved one. I had some clients that get 2 hours a day for 5 days, and there's like 4 hours for for a week. So it's when you do the application, VA will review, and then they will make decisions of how much caregiving services that they can provide your loved one. So
Mm-hmm.
that's an awesome information. So
Yeah.
that's something that you can ask your loved one's primary doctor. Now the counseling part. This is what Christine does, and she's been a social worker and a psychotherapist for over 20 years. That's amazing, right? I mean, lots of experience.
Yes, that's some
So she's
experience.
yeah, she's the go-to person. And let us know about your counseling services, Christine.
Yes, so right now I'm providing some in-home counseling for Medicare patients, and then as well I do some telehealth. I find that the virtual platform is great, and I'm happy to see people through insurance or private pay for a variety of issues. If caregivers need some support and some supportive counseling and need some help with direction, I'm happy to provide that. I've done counseling in a lot of different areas in the past. I've done a lot of couples counseling and individual counseling for depression and anxiety, adjustment issues, workplace issues, trauma. So I consider myself to be a seasoned therapist, and then I'm taking new clients. So feel free to reach out to me, and we can coordinate a time to meet for, an initial assessment session.
Right. Well, you can definitely check her website, because when I was checking it, I'm like, her services are good for dementia caregivers, because they go through, I mean, the progressive disease. We work with the client, with the family. It's considered like it's a loss, because eventually we will know that they will progress and
Mhm.
decline. So the loss, and we deal with depression, having our loved one go through the Alzheimer's and dementia symptoms. So that's something that Christine can coach you on coping, and the accepting, because it's tough. It's tough to know that we just have this time where when is my loved one will not remember me, will decline. So those are the services that Christine can provide. Also, with your loved one in the early stage of dementia, where they are learning that they are losing their memory, and then there's isolation, there's depression, because
Mhm.
that feeling from your loved one that I you know i'm I'm seeing this, that I'm losing my memory, I'm losing my personality, and that's tough. So on that
Very
stage
painful.
of yes, yes, and that stage, you can contact Christine, and that's something that she can reach out to your loved one. If you live like remote or out of the state, Christine and I is in, we are in the Pinellas County. So those clients, Christine can come in and do an in-person visit. But for remotely, like outside of her territory, she can do the telehealth. She can do virtual, and you can contact Christine as a family member, as a dementia caregiver. If you're out of Florida, contact her and discuss. All you do is call her and make a consultation, and you can go from there because she has to know your concerns, your needs, and she's the perfect person to go to as far as keeping your loved ones safe at home when they are living alone, or if you are taking care of them, in the
Right.
same home. You can team up with Christine on how to, especially the emotional part of caring for your loved one. It's very overwhelming,
Hmm.
and burnout is real.
Yes.
You're caring for them day in and day out, and you're feeling like you're not having time for yourself. And that's something where Christine can coach you and help you out. Having the role of being a caregiver, and and at the same time making sure that you take care of yourself and having that healthy, positive life. All right.
Yeah, it's really the aging process can be very painful, and it's really a grief and loss process sometimes. And some people just need a lot of help navigating the system, and getting some insight. So yes, I'm a Florida licensed therapist, so I see most right now I'm seeing mostly people in Florida virtually under my with my license. But I will be getting licensed in other states as well, which is exciting. So
That's awesome.
all right,
And
this was so fun.
yes, for the website, we will provide it in the comments. So these are the contact information, so you can reach out to Christine. It's creatingpositiveoutcomes.com. And then we are sharing her contact number as well. So if you are a person like me that like to reach out and talk in person, you can call her as well. All right.
Awesome. This was so fun. Great to
Yes,
see
thank you,
you.
Christine. Yes,
Yay.
we are very, like happy to have you here and providing all this valuable information, because these are the things that we go to the client's home and we educate family. As simple as, this resources that you presented to us. I mean, having those knowledge and having those things, knowing that you have a support is a huge thing.
Yeah.
And
Yeah.
yes, and Christine is one of your contact as well, to direct you in the right places. Present your loved ones, condition your concerns, and she can help you from there. Thank you so much,
Great. Thank you
Christine.
so
Thank
much. It
you.
was fun. You take care.
Yes,
All right. Talk
yes. Thank
soon.
you.
Bye.
Now for dementia caregivers and needing the social work services and counseling, you can reach out to Christine. She is awesome. She is very thorough, and we collaborate with our common clients and families. And having the knowledge and knowing that you have this support and, consultation, and she will provide you the right direction of what your loved one needs, especially if you want to keep your loved one uh, being more independent and still be able to live in their own home. So I hope this is a very valuable talk for all of you dementia caregivers. And we will be bringing some more education, teaching, and to empower you caring for your loved one, because my goal as a dementia coach and a consultant is no dementia caregiver will be left alone and walk this journey of caregiving alone. It's a very tough job. It's overwhelming, and knowing that we are here and we can direct you and provide you the right resources. And hopefully, in this way, we can help you out and be the best caregiver for your loved one with Alzheimer's and dementia. Thank you so much, everyone, and have a wonderful weekend. And we'll see you again. Till next time.